I'm Emily McCourt. I'm an associate professor at the University of Colorado School of Medicine and the Ponzio Family Chair for Pediatric Ophthalmology at Children's Hospital Colorado. I'm here today to talk to you about personalized medicine, specifically a trial for one patient, often called an N-of-1 trial, for a child with retinitis pigmentosa. I want to talk about the process of creating a new precision drug, obtaining an individualized new drug or IND approval from the FDA, and share my hopes for creating a pipeline to give more patients the opportunity for targeted therapies. The IND approval my colleagues and I obtained earlier this year is for one specific patient who has retinitis pigmentosa. For background, retinitis pigmentosa, often abbreviated RP, is a degenerative disease of the retina. It is estimated to affect about 100,000 people in the U.S. RP is often first diagnosed in early adulthood, but can present in teen years and sometimes in younger children. RP gets worse with time, causing visual field constriction, poor night vision, and for many results in blindness. About 10 years ago, I met a toddler with poor night vision. After an exam and an electroretinogram, I diagnosed her with RP. She had multiple other medical problems and was seeing many doctors at Children's Hospital Colorado. After genetic tests, laboratory evaluations, hospital stays, trips to specialists, finally a diagnosis was made. Posterior column ataxia with retinitis pigmentosa, PCARP or PCARP for short. PCARP is an extremely rare condition. Also very rare were the genetics that caused PCARP in this patient. One of the genetic changes that this patient inherited is a missense mutation, a misspelling in the DNA. But the other mutation, the one that was harder to find, is a deep intronic mutation. Intronic mutations, specifically ones that are deep in the intron, can be targeted with a drug with the goal of helping guide the patient's body to make more normal protein. These drugs are Antisense Oligonucleotides, often abbreviated ASOs. When our team of geneticists, genetic counselors, and ophthalmologists realized that this patient could potentially be a target for personalized treatment with an ASO, we saw a glimmer of hope that we could at least try to help this child from going completely blind. The process of going from an idea to obtaining IND approval for an ASO drug for one patient is a journey that takes a motivated medical team, family involvement, philanthropy, patient engagement, solid research infrastructure, and sometimes a little good luck. Around the same time we started to realize that my patient could potentially be a candidate for ASO treatment, our team at Children's Hospital Colorado was already working with Tim Yu's lab at Boston Children's to treat another child with a different condition with an ASO drug. With the family's permission, we put our heads together with Dr. Yu's lab and started working on finding the ideal ASO, the antisense drug that would target the best starting and ending point in my patient's mRNA to make the most normal protein and the least abnormal protein. In 2020, the N. Lorem Foundation, a nonprofit with the goal of curing rare diseases using ASOs, was formed, and we partnered with N. Lorem to perform and fund toxicology studies needed for the IND application and for my patient's safety. With N. Lorem, we were able to take the final product to the FDA for approval. The journey from idea to drug creation to toxicology studies to IND approval to treatment has proven to be a humbling experience and a team sport. I met many helpful people on campus at the University of Colorado and Children's Hospital Colorado on this journey. The university's IND office prepared paperwork and facilitated communication with the FDA. The regulatory and research support through the Children's Colorado and the Precision Medicine Institute guided me from start to finish. Contracting teams made sure agreements were in place with multiple institutions. Support from leadership at Children's and within the departments of ophthalmology and genetics proved essential. Philanthropy, collaboration, and a campus with experience and resources made this precision drug change from an idea to treatment. Personalized ASO drugs cannot be created for any patient with a genetic disease. To be considered for an ASO, you have to have a deep intronic mutation. To justify developing a personalized treatment for any patient, the patient must have a diagnosis with no known cure, no known treatment, and with a natural history of significant morbidity or mortality. Most importantly, the patient with the rare disease and their family have to want to partner with you. They need to be okay with the ups and downs that research, clinical trials, and science can take you on. They need to accept risks of unknown and the limits of medicine. My primary goal is to prevent complete blindness in my patient. I hope that this work is more than treating blindness in one child. Our work is part of the creation of a pipeline for precision medicine with ASO therapy at Children's Hospital Colorado and on the Anschutz Medical Campus. For more information or to refer a patient, please contact our office.